17 minutes past 8 as we kick off this morning, taking a look at an event that had taken place at the Sandton Convention Centre. And after over 15 months of a genocide with death, destruction, displacement, devastation, we cannot afford to take things lightly, and more importantly, not take our eyes off the ball, particularly with those who are associated with this Zionist entity that has been promoting this genocide. And while this fragile ceasefire or temporary ceasefire is holding, we've still seen a lot of threats coming through from the likes of the United States of America and also from Benjamin Netanyahu. And South Africa, vigilant as we are, and we've seen a broad range of activists from 13 organizations, including NGOs, trade unions, medical groupings, holding a protest at the Sandton Convention Centre. Now, this is against the invitation of Professor Fabian Didi, who is a director of Sheba Medical Center, a speaker at the Congress, and we know that Sheba Medical Center is deeply integrated with the Israeli military, which has been conducting this genocide in Gaza for well over 15 months. And to unpack all of this, we are joined by a medical doctor, a member of the Healthcare Workers for Palestine, part of the organizing committee of the OSSA Conference Boycott, on the which took place yesterday, Dr. Rushda Lariza Khan. Dr. Rushda, assalamu alaikum wa rahmatullahi wa barakatuh, and welcome.
Alaikum salam. Thank you for having me.
Yes, Dr. Rushda, as I said, we need to be vigilant, and it doesn't mean that this temporary ceasefire at this point in time, and we're not too sure how long this is actually going to hold on. But at the end of the day, we still need to continue with our activism, because a lot is happening. And more importantly, we cannot allow people, and we've seen it right across many other parts around the world, where even IDF soldiers have been going, and they've actually been found out. And South Africa is no different with this conference that has taken place and the attendance of Professor Fabian Didi at the conference.
Yes, definitely. And they took the opportunity as part of their conference to invite an Israeli doctor from a medical center that is known to support and the IDF, and it needed an answer.
Well, it certainly needed an answer, and just take us through, obviously, why this is so important, why this is so critical, and it's actually encouraging to see a broad range of people from many organizations, activists, NGOs, trade unions, all actually coming together with a common purpose to protest against the invitation that was extended to this doctor.
So initially, it was our ophthalmologic colleagues who noticed that the organizing committee of the OSSA conference, so the Ophthalmological Society of South Africa's Congress this year, was going to invite this particular doctor. And in light of what has been happening over the last 15 months, they very rightly requested that he be removed from the program. After letters from the Islamic Medical Association, various ophthalmological doctors in their own personal capacity, asking the EXCO to uninvite him. He was initially uninvited, and then there was pushback by the Zionist lobby and a poll that a lot of doctors who are ophthalmologists in South Africa, who should have had a say, were left out of that poll because they were not paying members of the OSSA society. So then because they used that as a reason, 82% of them wanted him to speak. And as part of their reasoning, according to them, medicine and their societies are not a political society. In response to that, we decided, so Healthcare Workers for Palestine, that's the organization that I'm part of, spoke to the ophthalmological colleagues, and we also got the the BDS involved, and Healthcare Workers for Palestine is actually a PSO of the BDS coalition, and they were amazing. We managed to get everybody involved, including the trade unions. And I think what's very important to understand is that every single opportunity to protest against the absolute injustice in Palestine, it does not matter from which society it comes from. As healthcare professionals, we also go to the protests that have nothing to do with healthcare. And it was very inspirational to be able to get everyone together, and we're all speaking the same language, which is that this is unacceptable, not in our country, not under these circumstances can we allow this.
Yes, but also, Rushda, we know that Fabian Didi is a director of the Sheba Medical Center, which is so deeply integrated with the Israeli military. And you mentioned the Zionist lobby in this country as well. And again, looking at the Zionist lobby, doing whatever they want to at will, actually, in terms of driving this agenda. And we know that there is an academic, there is a cultural boycott in this country. But again, to put pressure on the likes of the pro-Palestinian activists, NGOs, whoever at the end of the day. And we see still the huge influence that the Zionist lobby is trying to exert on this country, particularly when it comes to hosting events like these conferences. And again, acting with total, I would say, without any care, and just pushing this agenda through and saying that people can come at will in this country when and whenever, wherever they can please.
So Prof. Didi's response was basically that he is an individual, and we are not boycotting individuals. But the fact that he is part of a medical center that is looking at, is complicit in the genocide, complicit in the oppression of Palestinians, that is important. The fact that he, in his responses to us, were that we should, healthcare transcends all of this. We should not be part of this boycott, etc. And goes on to, give us examples, or how magnanimously, or how he is instrumental in assisting Palestinian children. How he, a Palestinian child who needed, he's a retinoblastoma, so eye cancer specialist. So he deals a lot with pediatric ophthalmology, and how important he is, basically, and that he is coming with his skills to come and teach or lecture at this conference. But the point is, why? The only reason that these Israeli services, these doctors, need to transcend borders, organize to assist, so magnanimously assist the Palestinians, is because they're an occupying force in Palestine. It's the Palestinian healthcare system has been, even prior to the genocide, extremely affected by the fact that there is an apartheid regime in their country. So our chairperson, Dr. Sadiq Mullah, had written letters in response to that. They're publicly available, but those things have all been pointed out, and they do not answer any of the points that we have brought up. And what it's made to seem is that we are singling this man out. They are very unprofessionally and incorrectly started sprouting an Islamophobic response, making this about religion, when we all know, any freedom-loving people know, that this has nothing to do with religion. This is about oppression. This is about humanity. This is about, the apartheid, Zionist, racist Israeli regime that is affecting all Christian, Muslim, Palestinian people, and it does not have anything to do with religion. But that is one of their talking points whenever they are called out.
Yes. Now, I've just looked at the visuals that came up on screen on the protest action, and just to understand, what was the mood like during this protest, Dr. Khan?
It was really amazing to have such a diverse group of people together, and we had speakers. Our program was very inclusive of all. We managed to get the trade unions to come and speak, doctors from the ophthalmological department. Dr. Rahman Abdullah gave an excellent talk. Dr. Aisha Jacobs spoke on behalf of healthcare workers for Palestine. We had the chairperson of Samatu, Dr. Puti Rashabedi, as well, Dr. Shoaib Wadi from IMASA, and that was from the doctors component. But then we also had anti-apartheid stalwarts such as Reverend Frank Chikane and Mandla Mandela speaking, and the crowd was amazing. There were people from informal settlements who recognized that oppression anywhere in the world affects everybody. And because within our own country, we have a fair amount of oppression, we have poverty. We had a whole people from the peripheries of Johannesburg also all brought to the protest. And all of us were speaking with one voice, not in our name, not in our country. And we had where we set up, there's a balcony, and it seemed like a lot of the attendants of the Congress actually looked over and could hear what we were saying. And I certainly hope that some people are complicit in this because of a lack of knowledge. And if we can, I wouldn't say convert, but educate even a handful of people, and it would make a huge difference. They also, we noticed that in our crowd, so the Jewish Report and others were there. They've already released an article in response suggesting that the move to have a total Israeli medical boycott is a very dangerous thing because, they bring so much to the world and to South Africa.
Just as far as the organizers of this event and conference go, was there any engagement with them, Dr. Khan?
To my knowledge, and it is something one of the other media houses had asked me, nobody came out to speak to us. There was no head-on conflict. They were just looking over the balcony. The JMPD were there. It was a peaceful protest, and there was no conflict. But we didn't speak to them. All the communication had been via email prior to them reversing their decision to and then re-inviting him.
Yes. Now, the other issues are, obviously this was quite a major event that had actually taken place, and it is clear that the pro-Palestinian activists have made our position very, very clear. But again, the point I always make is we cannot afford to take our eye off the ball, because this is just one event that has taken place, and I'm sure that there are going to be many going forward as well. And we need to continue, because at this point in time, when one looks at the situation in Palestine, in Gaza, what is taking place in West Bank as well, a precarious situation, and again, supported by the United States of America. And after this interview with yourself, we're going to be talking about the freeze in funding by Donald Trump as well. We're going to be talking about HIV/AIDS relief, all of that at the end of the day. So South Africa at this point in time is under the radar. It is under the spotlight for our position and for our stance on Palestine.
Yes. I'm very happy to see. I saw the headlines yesterday where our President Cyril Ramaphosa had made it clear that we would not withdraw our case at the IJC. And from an organizational point of view, all the people that were involved, so the BDS was involved, PSA, PSC, there were 13 societies all came together. And the conversation that we had in our debriefing yesterday was that this is just the beginning. In fact, from a healthcare perspective specifically, calling for medical boycotts, complete medical boycotts, academic boycotts is what we're going to be pushing for going forward. And it's a long road ahead, but there are a lot of people who are going to be pushing for that. Our society, for instance, has over 1,000 members. We've called for people from the healthcare professions to come in and have their voices heard, because it is part of our duty. All human life, regardless of borders, to a healthcare professional should be important, which is what makes it so horrific when you have doctors saying that getting the academic knowledge about how a professor from an apartheid state assists with eye surgery, that is important, but the mass killing, carpet bombing, and loss of children's lives in Gaza is not important.
Well, certainly, and also I think when you look at the children that have lost their limbs, those that have lost their eyesight, those that have been blinded actually, and yeah, you've got an eye specialist that is coming through to South Africa again. A total disconnect, Dr. Khan.
Completely, absolutely. But they spew this narrative, but the world has opened their eyes. There are more and more people who understand that those are just all excuses. As we can see, this tenuous ceasefire, Donald Trump's pushing for, being very clear at what Biden wasn't as clear in saying. There's a lot of video footage from our protest that is on social media, and Reverend Frank Chikane gave an excellent talk where basically Donald Trump is saying exactly what it is, and he is a Hitler in the making, and yeah, basically. This is a long road ahead, and I'm actually so proud. We didn't have a lot of time to pull this together, because it was only in January where we found out that, or mid-Jan, if I'm not mistaken, that we found out that they were re-inviting him, and they were still trying to sort of discuss it through just dialogue with the committee, because it's a South African society. One would imagine that as South Africans, with our proud history of our the anti-apartheid movements, our freedom being begot by BDS, by boycotting, that they would not do something so horrific, or at least when you pointed out that we should not be doing this, that they would have changed their minds, but that wasn't the case. And I don't know if they were expecting as many, for us to respond in the way we did, but it was a very apt response to a lot of disrespect to our profession, disrespect to what is happening in the world, disrespect to our policies in South Africa.
Well, certainly, Dr. Khan, but we thank you. We say Jazakallah to you for taking time out this morning to provide us with that update and unpacking what had actually taken place at the protest yesterday. And as I mentioned, we need to still continue. There's a lot of work that lies ahead of us. And together, we need to work, whether you're looking at from a healthcare perspective, media as well. We know genocide has taken place. And there's just so much that we need to get together, the BDS, all of it, and at the end of the day, again, to make absolutely sure that these perpetrators of this genocide don't get into their comfort zone or become too comfortable, and we need to keep up the pressure. But for now, we thank you, and Jazakallah for your time. Assalamu alaikum.
Wa alaikum salam.
Dr. Rushda Lariza Khan was us this morning, a medical doctor and also a member of the Healthcare Workers for Palestine this morning, providing us with an update on the protest action that had taken place at the Sandton Convention Centre yesterday. We're going to go for a quick break. We come back, we're talking about the United States of America freezing funding to South Africa, and again, what we are witnessing, looking at South Africa, looking at our position, and particularly with regard to Israel taking the matter of the case of genocide to the ICJ. And we have these threats coming through from the United States of America. So a lot of uncertainty with regard to the PEPFAR program. We'll be covering that immediately after this.